We have put all of our systems in place. We are not taking anything for granted because we know that this is something that can grow very quickly, and so we need to put our efforts, as we are, into detection of any possible cases and then containment to make sure that the virus doesn't spread.
Ontario's Health Minister Christine Elliott speaking yesterday at a media conference designed to address what's been going on with coronavirus. In Quebec, there were 5 people being monitored for possible cases of coronavirus. The federal health minister said there are people in the country for sure, 5 or 6 in Quebec and maybe in Vancouver being monitored. But what's going on with all this? Do we have to be worried? Saw yesterday there were reports out of China of entire cities being placed maybe under quarantine is too much of an overstatement, but no one was going in and out of those cities as they deal with this. The comparison people are making is of SARS. Remember back in the day? Maybe that's not even a fair comparison. Someone who would know, though, Dr. Vera Etches, the Chief Medical Officer of Health for the City of Ottawa, and she's on the line right now. Good morning, Doctor.
Good morning, Matt.
So obviously the big concern people have, they remember what happened with SARS and they're getting a bit nervous. Is that even a fair comparison here?
You know, the information is evolving. We're getting better information as people study the situation in China, and it's a new coronavirus, which is, SARS was a coronavirus. We've had other new coronaviruses emerge since then. There's one called MERS-CoV. Each of them will have certain characteristics. It does look like the severity of this virus is less than SARS when you consider the number of people who have had the worst outcome, obviously, of death. It's 17 that are being reported, majority in older people who have other illnesses. So that's a bit of a different picture in terms of less severe when you consider there is evidence that this is transmitting from person to person and would be more widespread, have a spectrum of illness. So some of these cases are going to be not very severe at all, maybe like a cold. So this is information that we're still gathering, but there are some signs that point to a virus that's not as severe. You mentioned the comparison with SARS, and I think what's interesting to compare too is how different our systems are in the healthcare system. Right now we are so far ahead in terms of having guidance already in place for when a new respiratory virus emerges. That there's already written guidance about how to handle this, and so hospitals, for example, I just had a call with all the hospitals in our area. They already are doing what they're supposed to be doing every day, which is screening people for a fever, for respiratory symptoms, and any travel history when they come in to receive care. And so right away, people are able to identify if this is China, if it's Wuhan or neighboring provinces, and think about whether that test now for this virus needs to be ordered. And that's a difference.
Is that something that we learned back during the SARS outbreak, that these were precautions or steps that we had to start taking because of that outbreak?
Yes, I think that SARS has strengthened our systems. The difference in our laboratory capacity is there. So with SARS, there wasn't a lab test right away. Now we have a situation where, hospitals are able to talk to Public Health Ontario, the laboratory for public health testing, and they can determine whether that test is warranted. These are strengths in the system that just weren't there.
You mentioned that you were talking to area hospitals this morning. So does your organization and you, I guess as the head of that organization, really take the lead here in making sure that all the local hospitals are prepared? Or was that just a conversation to just touch base and see where everyone was at?
We all work together. We have strong networks. Again, these things over time evolve and get stronger. Ottawa Public Health hosted a conversation, but every organization has its strengths and contributes to a strong health system. So it was a bit of a check-in to make sure people understand the evolving situation. They understand how we continue to be looking for guidance from the province and from our federal public health agencies as they get guidance from the World Health Organization. It's to keep up that communication channel and ensure that also for the public, as messages need to evolve as we get more information that we're able to have that spread.
So right now, someone comes into hospital, into the emergency room with symptoms. They're asked if they traveled anywhere. Do we get to a point where people are screened right at the airport? And when do we get to that point? That's a federal question in terms of what kind of screening is happening in airports. There's some suggestion that actually the most effective thing is for people to self-identify if they've traveled to an area that's affected and they develop respiratory symptoms. So this is part of the role of the media. I think you play a role in terms of helping people understand if you have traveled to an area like Wuhan or neighboring cities that you yourselves want to be on the lookout for respiratory symptoms and be able to identify that early, to call ahead when you're getting assessment, so that people are prepared to take the right precautions and speed up that assessment process for you. These are again not all likely to be severe infections, and so it's early days. I think we'll see the system for sure. If somebody is severe enough to present at a hospital, is there. If people have questions, they can certainly call Ottawa Public Health or check in with their primary care physician. We're also sharing information with family doctors in the area. So we talked at the beginning of this about how there were people being monitored right now in parts of Quebec and in Vancouver. But what happens? Someone presents at the Ottawa hospital. They've been traveling. They have some of these symptoms. If we have a suspected case in Ottawa, what's the first step there? Is it notifying you at Public Health, the hospital? Do they take isolation precautions? Then what happens?
Certainly that infection prevention and control practice kicks in right away. So making sure somebody, when they present, they're given a mask, they're put into isolation. It's always the top priority. The clinical assessment of that physician or that healthcare team is going to assess the patient and understand, does this look like it could be a new respiratory infection? Does it look like it's something else? The most common respiratory infection circulating right now is influenza, right? So there are other questions to ask about that patient. But if it looks like they can't rule out a new respiratory infection with that travel history, the next step is to call the Public Health Ontario Laboratory, and the physician will discuss with the Public Health Laboratory whether that testing is warranted. If it goes ahead that they think it makes sense to rule out coronavirus, as I think you mentioned is happening in a couple of places, they're doing tests to rule it out, then that is a point where public health gets notified. This is now a reportable disease in Ontario thanks to the action the minister took yesterday, and that means that we will be ready to follow up with the person and ask them a bit more about their activities, to find out where they've traveled, where they've been, who's been in contact with them while they might be ill. And so that's a public health practice we do every day with many different diseases. We follow up with people who may be contacts to, again, make sure they're taking the precautions, they're aware, and we can contain the spread of infections.
It's interesting that you brought up coronavirus. I was thinking, or you brought up influenza, sorry. I was thinking yesterday when I saw this story, 17 people have died so far in China, and everywhere you look, it's all over the news. I mean, I have a TV monitor on right now. They just flashed a story about coronavirus and have switched, but the amount of people who die of the flu every year in our country or, in the United States is way higher than the 17 people in China of this virus, and yet that's getting all the attention. I don't even know what point I'm trying to make. I just think of it, it's very interesting. We don't treat the flu cases with this type of media attention, do we?
That's normal. I mean, the unknown and the new, it definitely generates more questions. That's a normal thing to have happen. I think you're absolutely right that we need to pay attention to the risk of influenza in our communities, and the messaging actually about how you can protect yourself is not dissimilar. So for the average person out there, the way you can protect yourself against the bigger risk of influenza, and when you think about coronaviruses, they spread through respiratory secretions, through coughing and sneezing. And so you can protect yourself by washing your hands, not touching your face, and your eyes,
that old cough into your elbow trick.
And the cough into your elbow, exactly. So, and then making sure if you're sick, you stay home. Those things make a difference in terms of spreading respiratory infections.
Doctor, thanks for your time today. Appreciate it.
Thank you.
Dr. Vera Etches, Ottawa's Chief Medical Officer of Health, on just exactly what's going on with the coronavirus and the precautions that our city has taken. She spoke to all the hospitals in the area this morning to develop